Today, we will be discussing two outcome measures, which are the Lower Extremity Functional Scale and the Berg Balance Scale. The first outcome measure we will be discussing is the Lower Extremity Functional Scale, or abbreviated the LEFS. This is going to be a self-reported questionnaire on how a patient perceives they can complete 20 different various tasks. This questionnaire will be looking at the overall level of function of the lower extremity for a patient, but it's specifically looking at many different areas of function, which could include activities of daily living, balance, coordination, functional mobility, life participation, occupational performance, quality of life, range of motion, and strength.
My name is Taylor Faulkner, and I'm a student physical therapist. So now that Ivy has given instructions on how to instruct the patient and administer the test, I'll be showing you how to score and interpret the test. So what you're looking at now is the questionnaire that Ivy gave to our patient. It has 20 everyday tasks that the patient rated on a scale of 0 to 4, ranging from extreme difficulty to no difficulty. The patient circles each answer, and you, as the therapist, have to tally their scores at the bottom of each column. And then the sum of those columns is the patient's LEFS score. The lower extremity functional scale ranges from 0 to 80. Ivy's patient earned a baseline score of 38 out of 80. With this test, the lower you score means the greater amount of impact your condition is having on your ability to function properly. According to the LEFS, Ivy's patient only has 47.5% of their maximal function, which means the results are telling us that this patient's lower extremities aren't currently functioning that well. Before we can use this test to our advantage, we have to know that the LEFS has a minimal detectable change of 9 scale points. This means that the difference between any two scores that you want to compare has to be equal to or greater than 9 before we can justify that they're getting better or worse. This first score can be used as a baseline for us going forward throughout treatment, and we can re-administer the test throughout treatment to help show the effectiveness of therapy on the patient.
The next outcome measure we will be looking at is the Berg Balance Scale, which is a performance-based outcome measure.
As stated on the previous video, I was unable to perform each task of the Berg Balance Scale for my patient because of time constraints, but in a normal setting you would follow this outline and you would do each of the 14 items that are listed, and then of course you'd put the score out to the right and you would total at the bottom. And so on the next slide we are going to interpret the scoring and kind of explain how that works and what that means for the patient. But this scale again is really just designed to look at a patient's imbalance, just their risk of falling. And so my patient was an elderly woman with a neurological issue of the Parkinson's disease. And so that's why we perform this scale on her. The main thing is just to make sure the patient has clear instructions and keep them safe.
As stated earlier, due to time constraints, I will briefly talk through the other 5 sections of the test that were not demonstrated. Sections that were not observed were sitting unsupported, standing unsupported, standing with feet together, stool stepping, and reaching forward while standing. After the patient has completed a task, you will rate their performance on a 5-point scale. For example, for our patient sit to stand test, stand to sit test, and standing on one leg test, it took her several tries, so she would receive a rating of 2 for each of those 3 categories. For her attempt at picking up an object off of the floor test and completing a tandem test, she needed minimal assistance from the therapist, so she would receive a rating of 1. She used her hands to help complete her transfer test and used her hands while completing her 360-degree turn test as well, so she would receive a score of 3. And just like our patient's attempt at standing with her eyes closed and turning her trunk test, a patient would receive a rating of 4, which indicates independence during the task. So let us assume that our patient's overall score was then a 35 after we have scored each of the 14 subcategories. We would then consider our patient to be of medium fall risk in the future according to the research and the reported risk profiles that have already been established.